I did the New York Daily News yesterday, very long interview on healthcare reform, on whether the White House meeting is going to accomplish something. And the problem is that we have this really deep conflict between private and public solutions, between looking at healthcare as a public good, as something that American society owes to every American to some degree, and at the same time, the fact that we are a capitalist country, that the prosperity of this country has been driven by the fact that people create organizations and institutions, companies, laboratories, hospitals, care facilities, and then make them commercially viable through good business practices. And when it comes to the cost of healthcare reform, the funding of how to deliver healthcare, we are really at this point struggling with how to separate out this idea of healthcare as a public good and healthcare as a commercial product. And no wonder this debate is so very difficult. I'm not going to show you little video clips that I have simply to save some time, but I have a little video clip of the Heritage Foundation, which is very, very business model driven and says public health, that's something we can talk about, but basically the United States is a capitalist country. We want private solutions and we want the private sector to be able to do this. And then, of course, there's the opposite argument, which is that health care costs and health insurance costs and costs of Medicare and costs of veterans health care and the costs of Medicaid are bankrupting us. They are slowly driving states to shift more and more of their revenue and their spending to that sector away from other things. So we have these conflicting interests, and when you go to the State House, you'll feel that anxiety among legislators between health care and that important value that we have, that necessity that we have, and those other pressures that are coming. I'm in the State House frequently, and every few days now, as we come to the zenith of the session, there are other interests in the State House with exhibits, with t-shirts on, with their name tags, shaking the hands of Rod Roberts and others and saying, we want to tell you why you need to listen to us. Ours is the most important issue for the state legislature this year, and that can be labor issues or education or other things. And so there are these competing interests that are so difficult because, of course, I know and you know that health care is the most important one. And if there is any extra money, it ought to be diverted to health care, right? Don't we know that? Yeah. I mean, next week when I give a talk to the teachers of Iowa Association, it might not be health care anymore, because I do tailor my comments to the audience. But healthcare certainly is important, and you have a very, very good case to make. I have a little list here of those things that are important that you should remember when you go back again this afternoon to talk to folks, and that is we have multiple players. Those players are all very important in helping us to find solutions, but they're often very conflicting players in the discussion over healthcare reform. You can see that you know what they are. I mean, the insurance companies and some of the best in the world are down the street from here and are growing and prospering and are the pride of Iowa as the second largest, and Des Moines as the second largest insurance center in the United States. You have the healthcare industry, you have public opinion, and there you have a conflict between those who are insured and not insured, and you know that. The reason why this Obamacare and the whole healthcare debate has been so passionate and has been so difficult is because if you have something, the fear of losing it is much greater than any promises about betterment in the future. And a lot of Americans have good access to health care, have health insurance, and can afford it in one form or another, and feel very threatened by all of the discussions about how to essentially bring change. You notice President Obama has decided to now move away from the word change. This week, the president decided that it's not so much about change, which sounds more threatening. It's really about reform. It's really about fixing. It's about tweaking, making little things happen. Because really what happened was, when you talk about major change, you are disrupting people's lives and making people nervous about what that all means. And I know that all of you are very wise and savvy, and my friends back there in the news media are very important, because very often on an issue such as this, it is very difficult to understand what all this means. There's a lot of neat stuff around in the internet, and this was a kind of a sarcastic little poster. Universal healthcare for all citizens? Don't be silly. That kind of thing is only for every other industrialized nation. We're in the business of war, not welfare. Well, you know, you can find all kinds of messages out there, but certainly the comparison of the United States to other countries is important. I think this is a problem, complexity. Some of you may not be able to see these slides, so I'm sorry I'm actually repeating these by word. I don't really think anybody understands the full complexity of the healthcare and health insurance system in the United States. And I apologize to you, because you are experts on it. This is your whole life. Some of you are distinguished, nationally known individuals. I still don't think you know everything there is to know about healthcare and health reform, because it's too complicated. It is like taxes. Wilbur Mills was the only member of Congress who ever really understood the American tax law. Then he fell into the basin with a stripper in Washington, D.C. and discredited himself. But he did you remember that, Wilbur Mills? He was great. But he did understand the U.S. tax code. He was the go-to guy. I don't think there is any go-to guy or woman in the United States for healthcare. It is simply too complicated and intertwined with too many other values. You know, should the military and veterans have their own healthcare system, or should the Veterans Administration be blended in and done away with? What about Medicare? What about Medicaid? How big should the role of government be? Should individuals? A guy called this morning to the show and said, we should do away with everything. Everything. Do away with all of that, and we would have the whole healthcare problem solved. Why? He said, because you'd go in to see your doctor, and your doctor says, well, you know, let's do an MRI, and let's do a CAT scan, and let's do these tests, and you go, how much is that going to cost me? Well, it'll be about $8,000, $9,000. I don't want that. Do you have anything cheaper that you can do for me? And the whole point was, if it wasn't paid for by insurance, Medicare, Medicaid, or the Veterans Administration or someone else, the cost factor would go away. People had to write their own checks and pay by cash or with their Visa card. We would have it all under control.